Welcome, everyone, and thank you for joining us this afternoon. My name is Rachel Smythe, and I'm the Education Coordinator here at the Caregiver Resource Center OC. Since 1988, the Caregiver Resource Center OC has been a trusted partner for Orange County families who are coping with the physical, emotional, and financial responsibilities of caregiving. By providing families with individualized supportive services, the Caregiver Resource Center stands apart as the only Orange County agency exclusively focusing on the needs of caregivers who are coping with a loved one's chronic illness. The Caregiver Resource Center OC provides family consultation, support groups, assessments and care planning, counseling, education, respite planning. There's a lot that we have going on over here. And we also host a live stream every month. And so this afternoon, you've joined us for our live stream, What is PACE? And so this afternoon, I'm joined by Victoria Angelis, as well as Antu Cow, who are both members of the marketing and outreach team for the Cal Optima Health PACE program. So I'd like to give you both the chance to introduce yourself before we jump in. And for those of you who've joined us on either live stream, whether it's Facebook or YouTube, please feel free to ask questions or add comments as we go through the live stream this afternoon. So our first question is for you both. Again, if you wouldn't mind introducing yourself, letting us know what your role is and the name of the agency that you work for.
Yes, my name is Victoria Angelis. I'm the marketing and outreach specialist for Cal Optima Health PACE. I've been with the company a little under a year, and I work with On2.
Good afternoon, everyone. My name is Antu Kao. I'm the supervisor for the marketing and outreach team here at Cal Optima Health PACE. I work for the company for about 2 years, and I work directly with 4 enrollment coordinators who help with the enrollment process into the PACE program. I'm very excited to be here this afternoon.
Great. I'm so glad that you're both here. And there's just so much out there to learn about. And I feel like PACE is underutilized. And so I'm so glad that you're both here to talk about what PACE is and how it can benefit those in the community. So pretty basic question to start us off here is, what is PACE?
Yeah, I can tell you a little bit about it. So, PACE stands for Program of All Inclusive Care for the Elderly, and that's exactly what we aim to provide for each individual participant. Not only do we provide services that you'd find at a community based adult services center, like some clinical support, physical therapy, occupational therapy, social services, but we have a full clinic that includes pharmacists, social workers, dietitians, and more to make sure all their needs are being met. And this is possible due to our interdisciplinary team, or IDT, which is a core part of the PACE program. They create custom care plans for each individual participant upon enrollment, and they meet at least once a year, usually more, to review that care plan and make any changes as necessary. The PACE model of care originally started in the 1970s in San Francisco with a program called On Lock, but it's now a nationwide model of care that's thought to be the future of senior care. There are over 150 throughout the United States, over 20 in California, and 3 in Orange County.
Wow. It's just really neat to hear about the history as well. And you kind of mentioned some of them, Victoria, but what would be some of the services that are included in PACE? So if I'm a senior in the community, or I'm a caregiver for a senior and I'm thinking about PACE, what are some of the services that are part of the program?
Yeah, there are quite a few. We have, like I mentioned, the full on-site medical clinic where the IDT team works. We have a day center with activities and festivities for a variety of holidays. We have transportation, which is a full door-to-door service. So we will pick them up from their home, take them to the center, maybe a doctor's appointment off-site if needed, and back home. We have physical and occupational therapy. We offer meals that are regulated by on site dietitians. And we also offer home care for those that may need assistance after hours or on weekends. We also cover all prescribed and over the counter medicines and medical equipment like wheelchairs, walkers, podiatry shoes, glasses, all as medically necessary. We also cover hospital care and long-term care.
Wow, really is all inclusive. That's so great.
Yes.
And so I'm sure it depends person to person, right? But typically, with all those different supportive services that you mentioned, PT, OT, doctor, how often will someone be seen by a PACE provider? Is it typically like every week? Is it once a month? What does that look like?
On average, a participant will probably see a member of the IDT 9 times per month. That could be their primary care doctor, it could be their social worker, the transportation team. So they'll see someone about 9 times per month, which I think is a huge part of the PACE program. Because of that frequency, we can see if their health changes much faster than a typical provider. We can see them, week to week and say, hey, so and so's not looking right today. They should maybe go see someone. And we can take care of that quickly.
Oh, that's great. And so typically when you guys are both getting people enrolled, or what are some of the reasons that someone might end up receiving PACE care? Are there certain qualifications, or are there typical things that you see that people are getting connected with PACE because of?
Yeah. PACE participants are typically 72 years of age. They usually have 6 to 7 chronic medical conditions that we work with them to help manage. They usually need help with their activities of daily living, like maintaining proper hygiene or grooming, dressing themselves, cooking, and that's where we can kind of jump in and help them. And our goal as a PACE program is to keep them living independently at home for as long as possible. And we try to keep them from being institutionalized or end up in hospice. So that's our main goal. And that's why people usually come to us for the variety of services and the convenience. With everything being in one location, we can provide all the services that they need medically, socially, and it often alleviates stress from their caregivers and the participant. It just makes it easier for everyone involved.
Right. Absolutely. So I mean, to me, you've shared some of this already, but what would you say
Mhm.
are maybe like the main benefits for a PACE participant or the family of a PACE participant? What would you say are maybe just really those things that, wow, this is so helpful, that maybe their regular healthcare wasn't offering?
Maybe I can add some points to that. I would just say, like you mentioned already, Rachel, the convenience. Knowing that my loved one is being cared for and someone is it's seeing their health profile, their conditions are being monitored, um, that we have this.
Oh no, it looks like Antu might have froze there. So we'll go ahead and we'll just switch back over to Victoria and I.
Sounds good.
Um, And there's always got to be something with technology, right? Even a few
Always.
years into using technology for almost everything, we still have lots of struggles with it. Um, so it looks like Antu's still frozen. Maybe her air conditioner's on a little too high, so she froze. Um, we'll go ahead and we'll move on to the next question, and hopefully we'll get her back.
Sure.
But maybe if you wanted to just pick up where she was leaving off, or we can move on to the next question. But the question I had asked was just for what were really the big main benefits that maybe regular healthcare doesn't have for a senior.
Yeah, I think we touched on most of them. That just it's so convenient. It helps the participant and their loved one because it's all in one place and it's very much preventative care. We try to keep them out of hospitals, so everything we do and because we see them so often, we're able to catch things and really care for them in every way we can.
Right. Perfect. And then, so I know there are many benefits of PACE, and as a former adult day healthcare employee myself, I worked with PACE in different capacities, and was just thought it was pretty incredible. Of course, I'm sure some people maybe see some drawbacks, or what would you say would be some of the things that maybe are the reason people hesitate to join? What would
Yeah,
those be?
we really only have two main reasons people wouldn't enroll in the PACE program. The first is that they would need to change their primary care provider. When you join PACE, it is all inclusive. So that means you have to join our interdisciplinary team. And it's really not possible to have a doctor on the outside because, I mean, you know how busy doctors' are. They don't have time to communicate with our IDT constantly. And so, for that reason, PACE participants have to be all inclusive in the PACE program and they can't see their primary care provider anymore. The same for specialists. In some cases, we may be able to if they're contracted with CalOptima, but that's not guaranteed, and it's usually easier to just be all within the IDT. So that's the main reason. Oftentimes, we find that people will come back after saying no, maybe a couple months later, and say, "Oh, I really do need all these services you provide. It's worth shifting," and that has happened. So it's all dependent on their need. But the other reason is that they're not able to receive IHSS anymore. And that's a factor that they may not be willing to give up. And that's why they pass on PACE. Hi,
Sure.
on too.
Hi,
Welcome
my
back.
apology.
No worries. We
No
said that maybe you
problem.
had your air conditioner too high, so you froze. So welcome back. I'm glad you've thawed out. And so we were just talking about maybe some of the reasons people wouldn't join PACE or they might be hesitant. Um, and
Yes. Do you want to
so
touch on
that,
IHSS?
Yes. So I'm sure Victoria maybe already mentioned giving up the doctors, right? So that's one of the um, main reason that we hear. The other one is also IHSS, because the PACE program is also part of Medi-Cal, and IHSS is also it's a benefit as a Medi-Cal benefit. So those who join the PACE program, they will have to give up the IHSS benefit. And so a lot of the time that can be a problem because the caregiver may be also benefiting from taking care of their loved one. And so it's something that the family have to think about and consider. Is that something that is worth giving in order to receive all this coordinated care for the family? And in addition to that, even if the family maybe they have a different caregiver um, at home, we do provide home care. That is something that we also provide in the PACE program, but the hours may not be the same amount as IHSS would give, just because we already provided all the coordinated care already, and so the hours would definitely not be as much as they would normally receive with IHSS. So there is
sure.
home care services that we provide, but just in a different way.
Right. Perfect. I'm glad you
Yeah.
mentioned that too, because I think that, as you both said, for some people that might be one of those drawbacks when they first hear that, but knowing that there is still some support, it just looks a little different, might be helpful.
Yeah.
Um, and so who, I know you're both connected with CalOptima Health. You're the PACE provider there, but I'm wondering, is there a bigger entity who oversees or regulates PACE programs? And then I know you mentioned it earlier, so there are multiple PACE programs throughout the county, state, country. Could you speak a little bit more to those things?
Um, so yes, so PACE is as part of the Medi-Cal, as it's paid for by Medi-Cal, so as we are regulated by the HCS. There is also a national PACE where we are a member. All the PACE programs are a member, so that we learn from each other. Provide They're not really regulations per se, but they provide guidance and support. But definitely, we are heavily regulated by the state. Um, then there are multiple PACE program in California, uh, and in Orange County right now there are three PACE program in the county. CalTMA being the first one, We've been in operation for about 10 years now, but there are two other PACE programs. PACE program though are also the services provided are uh, within certain zip code area. So depending on where you're located, certain PACE program will give you the services. Captain Health is actually the only one that can provide coverage for the whole county, but the other PACE program services are provided based on where you are located, your zip code.
Okay. Wow, I didn't know that. So thank you for sharing that. That's helpful. And I know that you said this is a program that has to do with Medi-Cal. And so I'm wondering, what would be the cost of PACE services? Is this covered? Is there co-pays? What does that look like?
Yeah. So first of all, even though most of our, I would say probably 99% of our participants are Medi-Cal recipients, anyone can actually join PACE. It's just that the premium is very high. So usually, we talk about probably around 8,000 if they just pay out pocket. So it's a very per month. So it can be it costs a lot and not something that everyone can afford. But if you have Medi-Cal, if someone have Medi-Cal and they have no share of cost and everything is it's paid for by Medi-Cal. If and the share of cost, by the way, can be a few dollars to maybe a few $1,000. That's determined by the CS, right? So we don't know what that share of cost might be. Every participant would be different. And then if the participant only have Medicare, then they will also have to pay a premium, and in addition to Part D. So that can also be pretty prohibitive in terms of the cost. That's why, again, the majority of our participants receive Medi-Cal.
Okay. And so it doesn't matter, though, if somebody has Medicare and Medi-Cal, they would still be able to access PACE.
Yes, actually, they have that. We have about 50% who are Medicare and Medi-Cal, so the dual recipient.
Oh, great. And what about if they were receiving VA services? Would that have any impact as long as they also still had Medi-Cal?
Yes, so we do have a few participants who does have VA. I think maybe there's some impact depending on what kind of services that they have, because I know that the VA sometimes when they go into that program, they does have certain benefits. So that's going to be like a special case. So if anyone has VA benefit, we still would encourage you to give us a call and we can talk about it and we can explore more on what kind of benefits that they will be receiving, or if there's any kind of conflicts that we need to be resolved. But mainly we do have participants who have VA and join our program.
Okay, that's good to
Yeah.
know. And so how would somebody, let's say somebody's listening, they are very interested in getting connected with PACE. Do they have to have a referral? How do people actually get enrolled into the PACE program?
Yeah, I can tell you a little bit. You can contact us directly. All of our information is on the CalOptima Health PACE website, and if you reach out to us, we'll answer or we'll call you back with as much information as we can. Our enrollment team will walk you through the steps on the enrollment process, answer any questions you'd have, and you can also be referred by a friend, family member, or healthcare professional. But we would never just cold call anyone. It's a voluntary program, so we love when people call in and ask for more information. So we're open to that.
That's great. So no referral is needed. They don't have to wait for something from their doctor. They can just go ahead and call.
Exactly.
Good. Great.
If I can also add, because I know that maybe
Sure.
there are providers or community partners that might be on the call, and if they would also be welcome to send a referral to us. Our referral form, we do have a referral form for partners online, for any of the clients that may benefit from the program. So we do take referrals too. It's just that we just need the consent from the participant themselves via the, the connections with whoever is providing us the referral.
Mhm.
Okay. Okay, that's
Yeah.
helpful. And generally, will someone have the same PACE providers? Do they generally have the same doctor, same social worker, or how does that work in terms of, because I know you said there's this interdisciplinary team. One day I'll be able to say that right the first time. But is it, or do they have like a specific set of clinicians, or how does that part work?
Yes, so they would be assigned to a specific interdisciplinary team. It is hard. We just shorten it to IDT all the time. um, so they'll be assigned one IDT team, and they'll meet with those team members for any healthcare needs. Their social worker will see them throughout the entire thing. It's all one interdisciplinary team for them. And if they want, they can always request a different interdisciplinary team if they want to. But if everyone's happy, there's no issues, they can stay with those same doctors as long as they'd like.
Okay, great. And then, so when it comes to getting care, is there, does the participant need to schedule, or things scheduled for them? Do they need to call? What does it typically look like? I know you mentioned that on average, somebody's seen about 9 times a month by someone on the team. Um,
Mhm.
but what is that? Do they call when they need help? Are there automatic appointments scheduled? What is that? How does that work?
Antu, do you want to answer that one?
Yeah, sure. So we there's a care plan when the participant come into the program. So immediately uh, after enrollment, they will be assessed by the IDT team. And so that care plan will dictate like how many hours of PTOT they may have, how many days they will come into the center, if they have any kind of conditions like dialysis, for example, that need to have appointments being coordinated for them, any kind of uh, wound care or anything that they will need on regular basis, any kind of concerns that they have. So all of that are being assessed, right? And so they come up with this care plan for them. So of course, any kind of appointment that's already there, like dialysis, automatically our team's going to be um, taking care of all of that. The social work team will be making appointments. We have our medical assistants scheduling all this appointment. Our transportation team will come to the home and pick up. So basically, it's just about we really the team does all this care planning, um, and again, it's illustrate how great it can be for the family member. Because normally, if I were to if I need to take my dad to a doctor appointment, for example, right, I have to call and then let's go to the PCP first, right? And then get maybe an authorization, and then I'll call whoever the specialist is, and then I make the appointment, and then I'll take that's are being taken care of by the team. And then, of course, if there's any concern, any maybe emergency care, we would just say, go straight go to the hospital if there's any kind of immediate life dangers, right? But let's say that there are some concern, maybe it's not that urgent. We do have 24-hour line that the participant can call and just ask. We can provide that assistance. So it's both, right? We have this care that's already being scheduled based on the needs of the participant. Again, we anytime that there's any change or any problem, then the participant will then call us, and then we can assist.
That's great. And you actually answered my next question too, which was, what if I needed support in the middle of the night? Would PACE be accessible? And so you said that there's a 24-hour line. And
Yes.
then you also mentioned, with emergency care that you would, encourage the person, call 911, go to the closest emergency room. Does PACE stop if someone goes to the ER, like hospice might, or how does that work with the services with PACE?
No, they do not lose their PACE services. In fact, when they go to the hospital, we have a member of the team that will go to the hospital to monitor their care, report everything back to the IDT, and then they even help transition them to skilled nursing or wherever they need to go after the fact. And all of this often reduces hospital stays. They can get out faster because we're there to help with the process and answer questions, report back to their doctors. So it usually cuts down on hospital time.
Okay. Um, and then, so kind of along those lines, as we're talking about hospice or palliative care, if someone their health is declining and they maybe opt for palliative care or hospice, does that then cause them to be disenrolled from PACE, or how would that work with hospice or palliative care?
Yeah, PACE
Um,
participants oh, go ahead, on to.
no, go ahead. No, go ahead, Victoria.
I was just going to say that most PACE participants need care on a intermittent basis, whereas hospice and palliative care is more 24/7 care. So in that case, PACE may not be the best suited program for their needs. Our goal is to help delay the process, help them age in
Mm-hmm.
place, stay active and independent at home. So that's where PACE kind of falls on the spectrum between independent and hospice.
Okay. Okay, that's
Yeah,
helpful. Then, Antu, did you want to add to that as well?
yeah. Because I also want to add, because I think Rachel, when you're saying that if the participant is already in the PACE program, right, and they need
Mm-hmm.
to go to hospice or palliative care, so that is something that it would be a conversations that we would have with the family and see what's best for the family. We
Mm-hmm.
do have participant, we do have support for hospice, that palliative care up to the end of life. So that is something that we can also cover and provide. But I know that sometimes family would prefer to just enroll in hospice. So that's also an option if
Okay.
they already are in the PACE program. But if they haven't been and they need palliative care, hospice care, so that's something that's beyond PACE, what PACE
Mm-hmm.
can provide, like what Victoria just mentioned.
Hmm.
Okay.
Very case by case.
Yeah.
Right. Well, good. Good. And then, so how long can someone receive services with PACE? Is there a max? How does that work?
As long as they want, they
Okay.
can be in the PACE program to end of life, as Antu was saying, unless they want to transfer to hospice or something. But they can stay with us as long as they'd like.
That's great. And we have just a few more questions here. If a family, I guess my question with this next one, I wrote down, if my loved one needs support with medical tasks like medication management, wound care, insulin, is that something that PACE can help either train the patient themselves or their family? Because sometimes caregivers are being asked to do pretty medical based tasks that they're not necessarily trained for. And I know that can be really scary and stressful for families. So, is there support for the families and the participant if those are needs that are going on?
Yes, yeah, definitely. We do provide training for participants if they need help with providing those kind of medical task in order to support their loved one. We depending on the participants and their scheduling, right? Again, every case is different. If they are brought into the center, um, we the nurses here can also support either give the insulin themselves. But again, that's depending on if they come into the center, if the care plan call for that. But definitely, we do provide support and training for the caregivers to be able to help the family at home, the family member at home. Yeah.
Hmm. Um, and then, so with earlier, just to kind of go back to how we talked about families would need to give up IHSS, but that there is some home care support available. Do those individuals work specifically for PACE, or do you all contract with in-home care agencies, or what? How does the setup there?
We are contracted with in-home care agencies. So when a participant is determined that they need home care hours, then we would have vendors. We would reach out to our contractor, and they would find a home caregiver to go to the participant's home. Um, if a participant already have someone that's caring, like a home care person themselves, maybe that's something that can also work out and try to work with the vendor. But we have vendors who will provide those kind of services.
Okay. And just kind of, I guess, based along those lines, and I apologize, I hadn't thought of this question until right now.
Yes.
If somebody is a recipient of PACE, are they still eligible to receive any support through the CalAIM program? Um, or, I know all of that's still pretty new, so I'm just wondering how PACE and CalAIM would interconnect.
That's just a great question because we actually have that questions that come up all the time, right? And like you said, it's pretty new, so we
Mhm.
it took a while for us to navigate that. But what we were able to determine is that so the services for that CalOptima that CalAIM provide is also the same as what PACE provide. So they are not the participant will not be able to receive both at the same time. However, the services that CalAIM provide is more temporary in nature. um
Right.
uh, it's a lot of it is not something that is going to be last for a long time, whereas pays is something to be that meant to be for more of a someone with stable living conditions, stable home family support. It's long term. So
Mhm.
we normally when participants come in, depending on what their needs are, if it's something they need something that's really urgent right now, they need find some place to stay and really immediately help, we usually refer them to CalAIM first. And then once they stabilize, maybe finding the housing and everything is good, then that's when we can then follow up and then transition them into the PACE program. So that's what we think would be the really good to kind of work in tandem of each other and then really how those two programs can work together. But again, they cannot receive both services at the same time.
At the same time. Okay. Yeah, and
Right.
again, that's it's this new area that all of us are navigating and trying to figure out how
Yes.
we all can work together and serve. Two
Yes.
more questions. Um, so, what about when it comes to supplies? If somebody needed a hospital bed or maybe incontinence supplies, or, I know earlier it was mentioned that medication is covered, but what about those other types of things? Any durable medical equipment, bed, anything like that?
Yeah, we do provide supplies if medically necessary. And it is a variety of equipment. It could be, like I said, wheelchairs, walkers, glasses, handrails. So it's definitely case by case. And as the IDT deems medically necessary, we can try to provide what they need.
Great. And the last question that, if you both would like to answer, is what do you think is important for a family member to know about the PACE program? If there was one
Mm.
thing that anybody takes away from this afternoon together, what would be the one thing you'd hope they'd take with them?
Yeah, I'll go first.
Mhm.
I just think everyone should know that it's really an all inclusive program. We try to do everything essentially under one roof. Even if it's specialty care, we'll do the transportation there and back. Our IDT is very thorough and they will assess everything medically, socially to make sure they're getting the best care possible. And it's all very focused on prevention. We want to make sure that we're catching any changes in health because it's bound to happen at some point, and we want to make sure there's less burden on the family and the caregivers to make it as easy as possible for them and the participant.
Thank you,
I
Victoria.
I think for me, I would just want to add that, and I don't think we've covered this. In terms of the risk, there's really is no risk to try pace. You can always go back if you try out the program for about 3 to 6 months. We encourage that to at least a few months to see the benefit of the program, right? And if you, after joining PACE, if you find, what, this is not a program for me, you are free to really disenroll from the program at the end of the month. So it's not, you don't have to wait until the next um, opening, for example, open enrollment in order to disenroll from the program. So there is not a lot of risk in trying out the program. The only
Mhm.
thing we do advise is that just stay for at least a few months to see the benefits of how that can be
Hmm.
helpful. Because I know that the first month of transition can be very chaotic for some families just because we do a lot of assessments, right? And then we don't know
Mhm.
what the benefit is until after a few months, try it out. Um, and so I really think that sometimes you don't know if it's really is a right program for you or your family or your loved one until you try. And then sometimes, family circumstances change, right? So maybe it might not work out right now, but maybe in the future, that might be something that is a good options. So I always say, like always have that. We really work hard in order to help the community understand the model and know how that is an option that they can consider for their loved ones and for themselves.
Yeah, I'm glad you added that as well, because I think that is always a little scary because, there's only certain periods typically where we can enroll or disenroll. And so I'm glad that you brought that up as well. So thank you for that. And really just thank you both so much for joining us this afternoon and taking time out of your schedules to tell us such important information about what PACE is, what the PACE program does, and how it can benefit families and patients. And for those that joined us in the audience, thank you for taking the time to be with us this afternoon. We hope this information has been helpful. We will have another live stream next month on the last Monday of the month. And that will be Monday, July 29th, same time, 3 to 3:30. And next month, our topic will be what is hospice. And so hopefully you'll be able to join us for that. And thank you again, everyone, for your time, and take care. Thank you again.
Thank you.
Thank you.